Antidepressants. We've all heard the word before, but what do they really do? If you've ever gone through heartache, whether from a breakup, the loss of someone you love, or just that overwhelming sadness that won't go away, you know how heavy that emotional weight can feel. Sometimes, no amount of distraction, exercise, or just moving on seems to help. And that's where antidepressants come in. But how do they actually work? And are they really as effective as people say? Antidepressants are medications designed to help rebalance the chemicals in your brain, chemicals that directly affect your mood, your emotions, and even your ability to cope with stress. Your brain naturally produces neurotransmitters like serotonin, dopamine, and norepinephrine, which regulate how you feel. But when these chemicals become out of balance, things can get dark. That's why heartache doesn't just feel emotional. It has a real biological impact on your brain. Doctors often prescribe antidepressants to people struggling with severe depression, anxiety, or chronic sadness, especially when these feelings don't improve over time. Now, here's the catch. Antidepressants don't work overnight. Unlike painkillers that offer quick relief, these medications work gradually, helping to stabilize your mood over weeks or even months. Think of it as slowly rewiring your brain to function in a healthier, more balanced way. But not all antidepressants are the same. There are three major types that are most commonly prescribed. The first are selective serotonin reuptake inhibitors, or SSRIs. These are the most widely used, including medications like Prozac and Zoloft. They work by boosting serotonin levels, which helps improve mood and reduce anxiety. Then there are serotonin norepinephrine reuptake inhibitors, or SNRIs. They work similarly, but also target norepinephrine, which can help boost focus and energy levels. And then finally, we have tricyclic antidepressants, or TCAs. This is an older class of antidepressants, and they're less commonly prescribed today due to stronger side effects. But here's something important to remember. Antidepressants aren't a magic cure. While they can be incredibly helpful, they're not a one-size-fits-all solution. It often takes trial and error to find the right medication and the right dosage. And yes, some people experience side effects like nausea, dizziness, or changes in appetite. That's why working with a healthcare professional is crucial to ensure the treatment is right for you. And here's the thing. Antidepressants work best when combined with other treatments. Therapy, exercise, a healthy diet, and proper sleep all play a role in emotional healing. If you're struggling with heartache or depression, don't hesitate to seek help, because reaching out is the first step toward healing. Now, anti-anxiety medications. We hear the term all the time, but have you ever really stopped to think about how they work? If you've ever been overwhelmed by that constant gnawing worry, the racing thoughts, the tight chest that won't let go, then you already know how anxiety can take over. It's like this. No matter how many times you try to talk yourself down, or how many calming breaths you take, it feels like anxiety just won't let go. That's when medications come in to lend a hand. But how do they really help? Let's break it down. Anti-anxiety medications are designed to help your brain find its balance again. They target the chemicals that play a major role in stress and anxiety. Chemicals like GABA and serotonin. These neurotransmitters are responsible for calming us down, but when they're out of balance, it can feel like your body is stuck in fight or flight mode. When you're experiencing anxiety, your brain is flooded with signals that something's wrong, even if there's no immediate danger. And that's where medications can step in to help calm things down. They don't just act on your thoughts. They work on your brain chemistry to help you regain control over your emotions. Now let's talk about how they work. Benzodiazepines, like Xanax or Ativan, are typically the go-to medications for anxiety. They're fast-acting, so they can bring quick relief when you're in the middle of a panic attack. They target those calming chemicals, helping to slow everything down, making you feel more grounded. But here's the key. These medications aren't the end-all, be-all. They can help you manage your anxiety in the short term, but they're not a permanent fix. And while they're effective, they don't work the same for everyone. You might have to try a few to see what works best for you. It's important to remember that anti-anxiety meds work best when combined with other treatments like therapy, lifestyle changes, and techniques like mindfulness. It's a holistic approach. Your meds won't do the whole job alone. So, if anxiety is affecting your life, don't hesitate to reach out. Getting help is not only okay, it's the first step toward feeling better. Now, mood stabilizers. They are a crucial part of the heartache treatment process, especially for those who experience extreme emotional highs and lows. If you've ever felt like you're riding an emotional roller coaster, where one moment you're feeling on top of the world, and the next you're drowning in sadness, mood stabilizers might be what you need to find that emotional balance. These medications help to smooth out those emotional spikes, preventing the extreme highs, mania, and the crushing lows, depression. Imagine being stuck in a wave of strong emotions, but instead of constantly getting pulled under, these meds help to level out the storm inside your head. The most common mood stabilizers include lithium, valproate, and lamotrigine. Lithium is one of the oldest and most well-known medications used for bipolar disorder. It's a game changer when it comes to controlling manic episodes, keeping those intense, overwhelming feelings in check. But it's also highly effective in preventing depressive episodes, helping you avoid those low points that can make heartache feel even more unbearable. But just like antidepressants, mood stabilizers don't offer instant relief. They work gradually. It's like a slow burn where they help adjust your emotional rhythm and bring more stability over time. And yes, just like any medication, it may require tweaking to get the right dosage for you. So working closely with a healthcare professional is essential. While mood stabilizers can be incredibly effective, they do come with potential side effects, such as weight gain, dizziness, or tremors. But remember, emotional stability is worth the effort. And while they help with balancing the chemical fluctuations in your brain, they work best when combined with other treatments like therapy, exercise, and a healthy lifestyle. Now, antipsychotics. These medications are often prescribed when heartache becomes more severe, when emotional pain spirals into extreme mood swings or even psychosis. They help stabilize those mood shifts and can even reduce delusions or manage hallucinations that may emerge during deep emotional distress. When heartache evolves into something more intense, something that makes you lose touch with reality, antipsychotics step in to help. These medications target brain chemicals like dopamine and serotonin, which heavily influence your mood and perception. By regulating these chemicals, antipsychotics help bring a sense of balance and control back into your life. There are two main types: first-generation antipsychotics and second-generation antipsychotics. First-generation antipsychotics primarily target dopamine, but second-generation medications like clozapine or risperidone also target serotonin and generally come with fewer side effects. But here's the catch. Antipsychotics aren't a long-term solution on their own. They work best when combined with therapy and ongoing support from healthcare professionals. Now, beta blockers, commonly used for heart-related issues like high blood pressure, can also help manage the physical symptoms of anxiety caused by heartache. When you're emotionally distressed, your body often enters that fight or flight mode. Symptoms like a racing heart, sweating, and tremors can make everything feel so much worse. And that's where beta blockers come in. These medications work by blocking adrenaline's effects on your body. They target receptors in the heart and blood vessels, helping your heart beat more slowly and with less force, ultimately easing those overwhelming physical reactions. But here's the thing. While beta blockers can help reduce the intensity of physical symptoms, they don't directly address the emotional side of heartache. Medications like propranolol are sometimes prescribed for people experiencing severe physical reactions to anxiety or panic attacks, but these aren't a cure for heartache. They can only offer temporary relief, allowing you to focus on your emotional healing. Remember, beta blockers should never be used as a long-term solution for emotional distress. They should only be used temporarily and always in combination with therapy or other treatments for lasting relief. Now, cognitive behavioral therapy, or CBT, is one of the most effective therapies for dealing with heartache, especially when emotional pain feels overwhelming. But what exactly is CBT? It's a form of talk therapy that focuses on how your thoughts, feelings, and behaviors are all connected. The idea is simple. If you can change your negative thought patterns, you can change the way you feel and act. When you experience heartache, it's easy for your mind to spiral. Thoughts like, "I'll never get over this," or "I'm not good enough," can take over. And that's where CBT can help. CBT works by helping you identify and challenge these negative thoughts. With the help of a therapist, you learn to replace them with more realistic, positive ways of thinking. It's not about ignoring the pain, but understanding it and learning to deal with it in a healthier way. And here's the good news. CBT doesn't just focus on the past. It also helps you build coping strategies for the future, so you're better equipped to handle difficult emotions next time. Over time, CBT can give you the tools to break free from the grip of heartache and emotional distress, empowering you to regain control of your thoughts and feelings. Remember, cognitive behavioral therapy isn't a quick fix. It takes time, but it can be a truly transformative experience. If you're struggling with heartache, CBT could be a crucial step on your path to healing. Now, benzodiazepines. You've likely heard of them before, but what do they really do? These medications are often prescribed to help manage anxiety and insomnia, especially when the emotional pain of heartache becomes too overwhelming to handle on your own. When heartache hits, the physical symptoms of anxiety can feel paralyzing. Racing thoughts, a pounding heart, and a sense of tightness in your chest. That's where benzodiazepines step in. They work by slowing down your brain activity, helping you to calm down and regain a sense of control. Benzodiazepines like Valium or Ativan are fast-acting medications that can bring immediate relief when anxiety takes over. They work by enhancing the effect of a neurotransmitter called GABA, which helps to slow down your nervous system, creating a sense of calm and relaxation. But here's the thing. Benzodiazepines are not meant for long-term use. They're highly effective in the short term, but over time, your body can build a tolerance to them, making them less effective and possibly leading to dependence. That's why benzodiazepines are best used temporarily, alongside other treatments like therapy and lifestyle changes to address the root cause of the emotional distress. So, if you're dealing with heartache and anxiety, benzodiazepines can help in the moment, but always consult with a healthcare provider to find the right treatment plan for long-term emotional healing. Lastly, herbal remedies and supplements. You may have heard of them as a natural alternative to prescription medications. When dealing with heartache, many people turn to these options in search of relief. But how effective are they, and what can they really do for you? Herbal remedies, like St. John's wort and valerian root, have been used for centuries to help with mood regulation and emotional distress. These plants contain natural compounds that can support brain health and potentially improve your mood. They work by influencing neurotransmitters like serotonin and dopamine, which play key roles in how we feel. For example, St. John's wort is often used as a natural remedy for mild depression and anxiety. Studies suggest that it can help elevate serotonin levels in the brain, which may reduce feelings of sadness and improve overall mood. Similarly, valerian root is commonly used to help with insomnia and anxiety, promoting relaxation and better sleep. But here's the catch. While herbal remedies may offer some relief, they aren't a quick fix. They tend to work gradually, and their effectiveness varies from person to person. Plus, not all supplements are created equal. Quality matters, and it's important to choose reputable brands. Before turning to herbal remedies, it's crucial to consult with a healthcare provider, especially if you're already taking other medications. Some herbs can interact with prescription drugs, leading to unwanted side effects. Incorporating herbal remedies into your heartache treatment plan can be beneficial, but they should complement other approaches, like therapy and lifestyle changes, for lasting healing. And that's a wrap on heartache medications. But remember, if you're struggling with heartache, reaching out for help is never a sign of weakness. Never forget that. It's the first step to healing. Now, speaking of recovery, let's take a deep dive into something even more powerful: the most devastating natural disasters in history. Click on the link and come with us as we uncover some of the most intense and life-altering events that have shaped the world. Just click on the link below to continue watching this thrilling journey, because in this world of destruction, knowledge is power. And as always, remember, healing takes time, but it's always worth it. Stay strong, and we'll see you in the next video. Take care and keep growing. See you soon.